kids different digital skills through, virtually through open source technology. So that was 2 years ago. And then we revisited that platform, thinking how we can enhance our training, how we can bring in more into the space. So I feel that if we can continue to use these opportunities where we think more innovatively, to continue to enhance our education system, to enhance how we can commercialize our products and get them to the market. I think we are actually on the right, as much as we need to, as quickly as possible. I believe nothing goes to waste in what we have accomplished thus far. Yeah.
I see Shlubi. Shlubi has a hand.
For the productive from health department, and I just want to check, especially with Wits University, as far as I see the curriculum that has been delivered in students that are in the health field, curriculum there has got minimal technology. I just wonder if there are any plans technology in the design of health curriculum, because I believe that digital technological solutions, they can automate some of the work that is done by health providers. However, I see that in our space there's so much minimal technology healthcare providers in such a way that currently electronic records that we are capturing and our workforce, they are really struggling because technology was never embedded in the curriculum, tertiary education. So for us to close these gaps, have considered the design of health curriculum to include technology? And if there are plans, how far are we going to implement that? When are we going to implement that integrated curriculum that includes technology?
Sure, so I can certainly find out, but I don't have access to that information. So I just want to be clear, Simologong is owned by Wits University, but we're a separate entity. So we're not on campus, but we definitely work alongside different departments that are on a track around commercializing research that comes out of the university. And we focus on digital innovation. So we are separate. I can't comment on curriculum. What I can say is that I do sit on a forum with Donald Woodley, as well as with Zeldium. And there's definitely advancements there with regards to health tech that I'm sure will feed into the curriculum. But I comment on curriculum. I can find out and pass on information.
Okay. So that's an action item for me, Shlubi, to follow up on your behalf. I see there's a Shlubi, do you have a follow-up question? And then Refiwe, after she does her follow-up, then you can answer both, okay? Shlubi? Oh, okay. Refiwe, you can come in. Maybe Shlubi put her hand up again by mistake.
I'm sorted, thank you.
Yes, Refiwe, you can come in and respond.
Yeah, I think just to touch on just a part of the question on a general level, I think one of the biggest challenges as well has been the uptake of technology, where different organizations or companies introduce this technology to people, and they're not able to work with that technology, and it goes back as well to the design of that the design of that technology. You have to have people involved in the design. Most importantly, before you can even introduce that technology, people need to taught how to, or more like sort of there need to be some communication about the changes. Change is not easy, and again I'm going to go back to our industry, where even though we've got this technology, the drone technology, it hasn't been able to be used to its maximum because of communication and fear of that technology. And this is what we see everywhere, in different parts where there is a lot of fear, and people times just be there's a little bit of resistance as well. And with resistance, learning doesn't really take place as quick as it's supposed to be. But I think with communication and really making people understand how this technology can be able to make their processes much easier, and really showing them how easier those processes can become, people might actually be a little bit more susceptible to accepting and learning about that particular technology.
Thank you. We've got approximately 15 minutes before the ending of the webinar. I wanted to give each person an opportunity. Okay, before we do that, I see that there is one more question. I think we do have time to take at least one more question. Dorothy, we'll take you as the last question, and then after the response to Dorothy, I'm just going to ask each of you to kind of give the city a recommendation to what you think from your areas of focusing on and what we should be doing in order to transform ourselves into an inclusive, smart going forward, where these schools are highly prevalent. So can we take Dorothy's question, and then we can segue into the response?
Oh, thank you very much, Chairperson, especially for very, very informative presenters that actually have given us a sight and a light in whatever they are doing. I'm actually referring, I think, Karabo, but most of the presenters did talk about the same issue that I'm raising. We are now in COVID season, having those challenges of, remember that the surgeons of infection, the transmissions and all that. There's one time when we're actually thinking of how best can we come up with a way of digitalization, based looking into the screening process, trying by all means to digitalize everything so that we can avoid this main function role of a nurse. Remember, most of the things that the nurses are doing is just writing, diagnosing and all that. Now we're actually looking into maybe, is it possible for us to transition and come up with a tool that can be used, especially when you see a client, rather than to have this close contact or that social distancing, but using a tool, be very, very replicating what we want to see, and also to minimize our writing. And one of the challenges that we currently have now with follow-up of tracing is basically incorrect information that the people are taking when they all those NHLS documentation. You'll find that now they complete information that is not complete. Even the ID numbers are not complete. As a result, it becomes one of the time and making. Now I was just thinking that, is it now that we are talking about the smart city, where we can intensively offer own service delivery as part of improving that a safer city and smart city in our own environment. Thank you.
notification generates a notification to say, Ma, remember, and come for your medication. All those solutions are possible. We have to get to a point where we're seeing one patient, one file, regardless of which hospital, so that we don't have to redo some of the tests, don't have to waste time with the patient's history. They are right in front of you. We are able to do this. I think to your point, as we design the smart city, the places where we have, where we're struggling to deal with the load on the ratio between the healthcare required and the number of people, we need not be thinking anything else but to digitize half of those processes so that we can offer quality care, and at least the nurses can focus on the critical non-admin bits of providing healthcare, as well as the doctors, of course. But it's completely possible. We are seeing it with GPs. Some of the private hospitals are beginning to go there, but they're not even there, let me tell you. So it has to be a Department of Health strict to digitize.
Monique, can I find my response into recommendation?
Yes, you can.
Sure. So I want to one of his name is Tiri of Techno, and he came up with a smart box